This is Dr. Caroline Peterson talking to you today about swelling of the left leg. May-Thurner syndrome is one of the reasons that people could have swelling of the left leg. A lot of times they'll see their doctor and their doctor will be like, oh, you're just fat. You have a fat left leg. If they do a ultrasound and they don't find any clots in the veins, then they'll say, well, we don't know, just try to lose some weight, or maybe there's an incidental finding of bony growth somewhere else unrelated, and they think that maybe that's the cause. Or maybe they go to the foot doctor and the foot doctor says, well, yes, you have swelling in your leg and we don't know why. And a lot of times this could be because it's actually coming from higher up. So May-Thurner syndrome is something that's actually pretty darn common, but it's not talked about very much. And the symptoms can be anywhere from just a mild swelling of the left side of left leg, not the right one, all the way up to blood clots. It can also cause ulcerations in the kind of by the ankle because you're not getting good venous return. And so there's a gradient of impact. Some people will just experience some swelling at the end of the day where they notice, man, my shoe on the left side is a little bit tight. That's kind of weird. And maybe my leg is a little shiny. Maybe it's a little bit warm because the blood's not getting out of there. So there can be a whole range of symptoms. Like everything, everything's a progression. So things don't start off as cancer. They start off as things that are more mild. Sometimes they develop, sometimes they don't. And so a person can present at any point along the way. So it's interesting because this is actually happening far up. You can see at the lumbosacral juncture where we have the vena cava, the abdominal vena cava, and the abdominal aorta branch off right there into the common iliac veins here, and then the common iliac arteries. So how'd that happen? So you can see that the left common iliac vein is underneath of the right common iliac artery. And so if there's compression of the right common iliac artery onto the left iliac vein, then this is going to be an irritant to the vein, and the vein will respond by creating more tissue to push against the pulsations of the right common iliac artery. This is the way the body is. If you push something, something will push back. So this is the compression, chronic compression, that then can create kind of like a spur. They call it a spur. It's not a bony spur, but it's a soft tissue type of growth that then impairs the venous return because it encroaches, and so there's not as much room. So it's on this left side here, this common iliac vein goes into the internal and the external iliac vein. The external iliac vein is what pulls up everything from the lower extremity, and so the internal iliac vein is what pulls up blood from the pelvis. So if there's encroachment here, then you're going to have difficulties both probably with the lower extremity on the left and the pelvic drainage on the left, although there may be some forgiveness